All right. So today we're going to talk about differential diagnosis, what it is, and your role in this as a veterinary assistant. So in reality, there's five different things that only the veterinarian can do within the clinic. This doesn't matter whether you're a certified technician or a veterinary assistant or receptionist. Even if you have a um, bachelor's or master's degree in animal science, anything like that, these five things only the is allowed to do. They are prescribed medication, they're performing surgeries, stating the health of a patient, prognosing with diseases, and diagnosing. Now, saying that, vet assistants cannot diagnose. But one thing we can do, or one thing you guys can do, and you'll need to know to do this within the clinic, is to come up with a differential diagnosis. And this is just a list of possibilities. My dog's coughing. Okay, why is it coughing? Is it an old dog? Could they have congestive heart failure? Were they just at the groomers or were they boarded? Could this be kennel cough? The reason we need to know this, even though you're not diagnosing, is some of the things are very contagious, and we need to have the animals isolated. So, kennel cough, canine influenza, both of those cause coughing symptoms. Both of those cases, we would want the owners to carry the animal in, put them immediately into an exam room, no contact with anybody else, have them in the waiting or reception room for the least amount of time, so it limits exposure to other animals. That also kind of helps us determine triaging if this is an emergency. Vomiting. Okay. Vomiting is pretty non-specific. It could be worms, it could be an upset stomach, it could be pancreatitis, or it could be an animal, a dog with a twisted stomach. Okay. Gastric dilation volvulus. GDV, for short. GDV 100% is life-threatening. It needs immediate correction. So that animal needs seen right now. Whereas that dog that just has nervous anxiety and makes himself vomit due to stress, yes, we need to take a look at it, but it's not as critical. Right. So here's a differential diagnosis list for coughing, and um, I believe this was based on humans, but realistically, it's pretty much the same thing. Only we don't have a whole lot of animals that are smoking. Although we do see issues with vaping and some cancers showing up, oral cancers in cats due to residue left on the animals from vaping. So, history on this pet. This is about all we know. They've been coughing for 3 weeks. All right. Well, what could it be? It could be asthma. It could be GERD, gastroesophageal reflux disease. It could be bronchitis. It could be cancer. It could be pneumonia. It could be heart disease. All right. And then from that list of things, this one here also breaks it down and gives you a little bit more of testing or things that we can do to try to um, pinpoint, pinpoint more accurately what the disease actually is. All right, for this assignment, I'm going to give you a list of diseases. And I want you to go through your book for these chapters and come up with a differential diagnosis list. I don't want an exact list. I don't want you to say, absolutely, this is 100% hyperthyroidism. I want a list of possibilities. So this dog here comes in with anorexia. So they're not eating very much. They're just kind of tired and weak. They're urinating more and drinking more. All right, that one's going to be for your um, never mind. They also have vomiting. I don't know why I have anorexia on here twice, but I do. They've been experiencing some weight loss and they're just kind of depressed. They're not bright and alert as active as they often are. All right. So once I get through the list here, If you guys want to pause it, write those down. It's up to you. You can search for these diseases and then come back for the rest of the videos, or just watch through and write all your symptoms down and look them up afterwards. All right, for this one, this is urology or the urinary system. All right, this cat comes in because it's using a litter box. Cat's straining to urinate. Almost whines, whimpers when it's in the restroom. It's only going small amounts, maybe nickel dime size. Frequent trips to the bathroom. He'll be in, move around. Looks like he urinates, move around some, try a little bit more, come out of the litter box, and then go back in. All right. You are noticing some hematuria, so every now and then the cat will pee on the floor, or you can see that it looks like a little bit of blood in the urine. And then also this cat is anorexic. They're also not wanting to eat. For this one, this is reproductive emergencies. You guys are going to do one for the male and one for the female. For the female, this dog comes in, she's pregnant. The owner says that she has been straining to deliver for at least 30 minutes. She's whining, crying, vocalizing in pain. What could be the issue? And then for the male, they're straining to urinate and they have paraphimosis. So paraphimosis is when the penis comes out of the prepuce and doesn't go back in for some reason. This could be due to injury, due to trauma, due to mechanical blockage. Sometimes they get hair and debris wrapped around the actual penis and it can't go back into the prepuce. All right, so for this one, this is eyes. Um, Cat comes in. The owners say that the cat is squinting a lot, and there seems to be a lot of drainage from the eye area. Just the one eye seems to be rubbing, scratching at their face a lot, constantly rubbing that side of the face against the carpet or against furniture. And the eye almost appears like there's a haziness or whitish coloring to it. Right? Neurologic issues. So this dog comes in. Obviously, this guy has a head tilt. He's weak. He's recently trauma. He was hit by a car. Initially seemed okay, but now he's having some issues. Really stiff limbs, seems to be shaking quite a bit, and he has nystagmus. So when you look at the eyes, his eyes are twitching back and forth, left to right. Obviously, he has the head tilt there, and he just seems worn out, not warm out. Just seems worn out. Doesn't have much energy to do anything. All right, and that is the end of it. Go ahead, come up with your list, and then submit those to your instructor.